I'd like to welcome you to the university and in particular welcome you to this event on lifelong joints.
Why do we need lifelong joints? Because we're aiming to put these joints into younger people, people with different pathologies, different diseases. And we also know that because we put so many of these prostheses in patients already, that at 10 years, 5% of those will fail. And that's a big number. That's, in the UK itself, that's about 5,000 operations a year that go on to just doing the revision. And the revision procedure is never as successful as the primary procedure. So we need to make the prostheses both longer living, so i.e. lifelong joints, but we also need to make them more robust so that they can take the different loads and motions, they can take the different surgical techniques that a surgeon may use when implanting these devices. The project is addressing the challenge in two ways. The first way is the generation of this new coating. So we're developing a coating that's got a longer life, and also that if it wears in such a manner as though the particles dissolve. And that's very important because we know from contemporary studies on hip replacement that these particles can cause adverse immune reactions. The second thing it's doing is developing test methodologies which reflect better the everyday lifestyles of people with hip replacements. And it's doing that in a multifaceted way. It's doing that through enhanced computational models, which allow us to look at a whole set of different scenarios, so people walking upstairs, people walking downstairs, people stumbling, people falling over, so on and so forth. And if we stick them into the model, we can get a better understanding of how the hip replacement may wear or it may be challenged as we go forward. So we can predict, hopefully, whether this new type of material will be suitable for hip replacements.
I had a hip replacement 4 years ago, and really I've been able to now do a lot more things than I used to be able to do before, especially immediately beforehand because I couldn't walk very far. And now, I can walk 6, 7, 8 miles with no problems.
It doesn't really hold me back from doing anything that I really want to do.
My hip replacement has made my life a lot better.
I had a problem with my hip from really quite a young age, in my early 30s, and so for a number of years I wasn't able to cycle, and since I've had my hip replacement I've actually been able to take up cycling again, which is fantastic.
The number of patients who've taken part is 133, which we've been really impressed with. The amount of people that have actually wanted to take part in the study has been great. We got in touch with patients by firstly going onto a database to find out how many people have had hip replacements in the last between 1 to 5 years, and then what we did, we sent out them letters to them and asking them to give us a call if they were interested in giving us taking part in the study. We get the patients in, we mark them up with special little reflective markers, and then we ask them to perform activities of daily living, so things such as walking, fast walking, getting up from a seated position and walking up some stairs as well. The data we've gathered is going to be really valuable because we're not just looking at one type of patient, we're looking at different patient demographics. So what we were hoping to get is a really good sample of the population that actually use the hip replacements, and then we can try and improve the testing. But implants are currently tested to what we assume everyone's the same, whereas at the minute what we know is no one is the same. Everyone walks different, everyone performs activities slightly different, and this is the variance that we want to capture and then also incorporate into the testing of the implants. Anybody Technology has made this virtual human model which can simulate movements where we're going up and down stairs, walking, and all the data what we're producing is going to measure the different variances. So because not everyone's the same, we've got different heights, we've got different weights with different ages, we need to incorporate this into the virtual human model so we can simulate them.
About a year ago I had a letter asking me to take part in this project, and I've thought if it's going to help make better hips, make people have less problems with their hips, then that's something I would really want to take part in.
I took part in the research project because I felt that I'd had such fantastic value out of the hip operation I had, out of the NHS, out of Chapel Allerton Hospital where I had it done, that I felt I wanted to give something back.
Research is a wonderful thing, and if people don't come forward, we'll never ever progress.
So Leeds is very keen to involve patients in its research because one of our strengths is our clinical research programme. So whereas many universities focus on basic science, we're very proud of the fact that our research applies directly to patients, and the only way to have it apply directly to patients is to involve patients in the process. The benefits for patients for being involved in research are actually quite considerable. So right from the top down within the UK, NHS, the Chief Medical Officer, for instance, is very committed to involving clinicians and patients in research because we know that it improves care. So on a day-to-day basis, if you're treated in a teaching hospital or you're part of a research programme, you'll probably get better care than just the standard care that you'd receive in an ordinary hospital. So the benefits to patients, even aside from the engagement with the research project, are quite considerable. And of course the benefits to researchers are that we can translate what we do to where it really makes a difference. So whereas translation is sometimes referred to as creating a spin-out company or creating a product, we can actually make sure that translation is making a difference to the patients, to the taxpayers, to the citizens of the EU countries that pay the bills.
I think it's a very good idea that the EU funds this work.
I do think the EU should provide things. We put enough into the EU so that we should get plenty back from it.
I think the EU is crucial to doing this kind of work. That kind of cooperation, cross-European cooperation, I'm not even sure it would happen without the EU. The savings that will be made from the result of the research is going to well justify the amount, really relatively small amounts of money that are being spent on this project.